Welcome to Coronavirus The Rundown. I'm Usher Qureshi. Each day we showcase the ways communities are taking on the coronavirus. We also break down the headlines. Today, what could be next for relief? The Fed says we might be in for a sustained recovery from coronavirus. Chairman Jerome Powell said Congress may need to pass more relief bills to help prevent long-term damage. He didn't say what he thinks those bills should include. Lower incomes and less savings. A new survey shows how coronavirus is impacting Americans' finances. 30% of people say their income has dropped because of coronavirus in a new bank rate survey. A fifth of people say their emergency savings is down, and a quarter say they have no emergency savings at all. The virus has likely pushed 27 million Americans off their employer-provided insurance, according to the Kaiser Family Foundation. It estimates about 80% of them have other options through the Obamacare marketplace or through Medicare. Federal student loans will have historically low interest rates this fall. For the 2020-2021 academic year, the undergraduate loan rate is 2.75%. For perspective, it was 4.5% last year. The rate for parents is also down almost 2% this year to 5.3%. These rates only apply to new loans for the upcoming school year. There's a new push to forgive healthcare workers' student debt. Alicia Nieves shows us some of the proposals up for discussion right now.
On the front lines in the battle against COVID-19 are doctors, nurses, and other healthcare professionals. Communities around the country have shown their gratitude with cheers and shows of lights and sirens.
We need to do more to support them.
While legislators in the nation's capital have started to consider more tangible gratitude, possible student loan forgiveness.
That loan forgiveness in Congress, I think, is absolutely warranted and does have a place in the fourth COVID supplemental.
Matthew Schick is with the Association of American Medical Colleges, which is advocating for a student loan forgiveness bill that would help healthcare workers specifically.
Can ease the financial burden, ensure their focus is on what's in front of them.
But Congress has some tough decisions ahead. There are at least 5 different student loan forgiveness bills and proposals on the Hill right now. 3 tackle student loan forgiveness for almost everyone with student loan debt. The first 2 capping the amount to be forgiven, while the third proposes all federal student loan debt be eliminated. The 4th and 5th bills focus on workers on the front line. The HEROES Act specifically proposes student loan forgiveness for healthcare workers and other essential workers, capping it, though, at $25,000 per person, while the Student Loan Forgiveness for Frontline Healthcare Workers Act proposes eliminating all graduate school debt for healthcare workers only.
This might be the turning point to really invest in our physician workforce to help address not only COVID, but future public health crises.
Before this pandemic, the U.S. was already dealing with a growing shortage, especially in lower-paying specialties. The Association of American Medical Colleges believes loan forgiveness would help physicians focus during COVID-19, but also by eliminating some or all of their debt, more physicians could afford to serve in lower-paying but much-needed specialties, especially in rural and underserved communities, after this pandemic is over.
The biggest lesson that we can learn from the pandemic is that you can't wait till the last minute to act, and we need to be thinking about the future, because this isn't the last pandemic. It's not the last health crisis.
I'm Alicia Nieves reporting.
The 3 major credit reporting agencies are now letting you check your credit report for free each week. You typically can only check once a year for free. The change is in effect through April of next year at annualcreditreport.com.
If you're on a forbearance program or with your mortgage lender, or if you're in a credit card payment deferment, your account should not show that you're falling behind or that you're missing payments. It should appear as though the account is paid up to date, and it'll show the balance and it'll show the accurate status of the account.
But keep in mind, if you are already past due when you enter the deferment program, that will still show up. Some lawmakers are pushing for more protections. One bill proposes putting a 4-month moratorium on all negative credit reporting. But for now, it's up to you to protect your credit.
Is make sure that you're contacting anyone you owe, and you're trying to activate any special arrangements that can allow you to skip payments without penalty.
With any payments you have to keep making, make sure you're making them on time if you can. And as credit card companies lower credit limits, experts say to evenly distribute debt across credit card accounts if you have multiple ones. The National Foundation for Credit Counseling is a free resource if you need help with any of this. Well, businesses in rural America are up against unique challenges. Lindsay Boach looks at how people in these communities are enduring the pandemic while planning a way to find jobs again.
At the junction of US 285 and 50.
I mean, to stand out here and see all these mountains.
About 3 hours southwest of Denver.
It's a glorious place to be.
Sits the crossroads of the Rockies, Poncha Springs, a small highway town with about 700 residents.
It's kind of like we've been discovered. People are realizing what a great place this is to live.
And this time of the year, business is usually starting back up.
Phone's not ringing as much as it usually would be. Reservations aren't being made.
Teresa Dunlap has owned the Poncha Lodge for the past 8 years. A place where fishers, hunters, and hikers looking for a little peace and quiet come to stay.
From New York to Los Angeles, people love to come to Colorado in the summer.
Because no one's traveling,
it's quiet.
She has just one employee that helps at the lodge during the summer, but she's had to lay off employees at the 2 restaurants she has on the property, the Hunger Trailer and the Hunger Shack.
We'll be glad to, when things start getting busy again, either bring back some employees or rehire some employees or hire some new employees.
Both have remained open because they have a walk-up window. And while May isn't typically busy, things ramp up Memorial Day weekend.
Everything has been stripped and sanitized.
She doesn't know if that's going to be the case in just a few weeks.
I'm not sure what to expect for this summer. As far as business, we are not opening up the county hotels until June 1st. There's no way of knowing exactly if it will be a trickle of people that will come in or if we will be overwhelmed with people.
These highway towns like Poncha Springs survive on people coming through.
We can't recoup the business that we've lost. I don't want to dwell on that. I want to keep a positive attitude and keep looking forward.
In Poncha Springs, Colorado, I'm Lindsay Boach reporting.
Neighbors are helping neighbors get through the pandemic.
People are more willing to kind of look out for each other and help each other out.
The interesting trades people are making while life is on hold. And some veterans with coronavirus say the VA is turning them away. Hear from one of them next.
WRTV.
We're in a strange time where toilet paper, cleaning products, and even face masks are considered luxury items. They can sometimes be hard to get. So now neighbors are reaching out to each other to get a hold of these items. The app Nextdoor reports that during this pandemic, there has been more than a 260% increase in members talking about helping each other. Neighbors say they've noticed it too.
I think so. I think people are noticing how convenient it is. It also brings about a little bit more sense of community.
Michelle lives in L.A. She says she has traded a couple of things with her neighbors like fruits and plants and has noticed her neighbors are also more willing to barter for other essentials.
I've seen people saying, hey, does anyone know where we can find face masks? Because there's none online. We don't know where to get them. And people say, if you have the material or you go buy the material, I will make you some because I've just made some for my family.
Thousands of people are joining trade and bartering groups on social media. People who take part say that trading helps them stay away from crowded stores while saving some money. Well, some veterans with coronavirus are being turned away by the VA. Nicole Johnson looks at what's happening and a push for change.
A grim reality for our country's heroes. COVID-19 is attacking them at an alarming rate.
It's really scary and disappointing.
And some veterans in VA hospitals or facilities say they are not getting a fighting chance. Right now in VA facilities around the country, there are more than 11,000 veterans with the virus, and more than 900 of them have died, with New York and New Jersey having the most deaths.
I feel disappointed and left out. I mean, I would have thought that the VA would have got on this right away.
Justice Banks served in the Navy during the Vietnam War. He tells us COVID-19 knocked him down a few weeks ago with serious symptoms, headache, stomachache, and that's not all.
I must have either passed out or fell, because when I woke up, I was on the bathroom floor. And I was in that situation where you say, I've fallen and I can't get up.
And Banks says he was turned away from the VA because the hospital was not accepting any more emergency patients.
You're kind of fending for yourself. They are going to die. They are not in a position where they're going to get care through the VA.
Is it a question of neglect, or is it a question of having enough individuals to provide the service?
Wendy McClinton, president of Black Veterans for Social Justice, and her team say it's hard as it is for veterans to get services, let alone being in a home with this lack of PPE.
What supports? What do they need? What type of staff? How can we help them?
In a statement, the VA secretary responding to the pandemic said, VA has a world-class medical team doing incredible work on the front lines of this fight. We will continue to share best practices and lessons learned from our government. Meantime, Banks is grateful to be alive. He now has to navigate through a few bills due to COVID-19. And he prays for his fellow veterans and hopes the VA can give them a lifeline.
Once you've been in the military, you know there's a theme called hurry up and wait.
There was a significant spike in online shopping last month, according to data from Adobe Analytics. It turns out shoppers are buying pajamas. This comfy clothing saw a 143% boost in online sales in April. Meanwhile, pants saw a 13% decline in April. There were also 12% fewer bra sales. Coronavirus concerns have canceled graduation ceremonies for students across the country. As Kai Beach shows us, some leaders are getting creative to try and save them.
For the class of 2020, graduation ceremonies are becoming a bit out of the ordinary.
So I just pull up, right?
Seniors like Jerry Fang at Etiwanda High School in Southern California are now driving in cars with their families.
Got a mask in there. I don't want a mask. I don't want that mask.
And wearing commemorative masks on their faces instead of turning the tassels on their caps.
It was quite an emotional experience seeing kind of like our teachers and our school again after such a long time.
Fang and his classmates have been out of school for months because of coronavirus concerns. Recently, hundreds of students returned to campus by car to take part in what's becoming a growing trend across the country, a drive-through graduation ceremony.
I, as their principal, I owe it to them. I owe it to the class of 2020 to recognize them.
Dr. Mac Wolf is the school's principal.
Congratulations!
He says it took months of planning with local health and city leaders to pull off this emotional social distancing celebration.
You see tears, you see the emotion from parents, you see the emotion from kids as they come up, and it's exciting.
Exciting for some, a bit disappointing for others.
They just got cheated out of so much.
This is Noe Aguilera's daughter, Jacqueline. Noe says she supports social distancing. But seeing her daughter walk across an empty stage to receive her diploma was underwhelming.
You just sit there, you go into your car and you sit there and you're just like, was that it?
So over here we have my senior letter.
But for Fang, he's not focusing on what he missed, rather appreciating what he's learned.
I think it's a great wake-up call for our society to be more grateful and appreciate what we already have.
Etiwanda High will release a graduation video online at the end of the month, capturing how the education system was able to adapt during this pandemic.
For me as an educator, it says, hey, we're in good hands going forward, and that makes me feel good about that.
Moving forward, Fang says this pandemic inspired him to study global health policies at Yale. While Aguilera will join the Army with the hopes of being a combat medic.
Yes, baby!
I'm Kai Beach reporting.
Well, researchers are trying to figure out which animals are at risk for getting coronavirus, how this is impacting the future of zoos and animal sanctuaries.
Keller and Keller, right now.
Welcome back. Researchers are trying to figure out which animals are most at risk for getting coronavirus and what it means for transmission to people. As Amanda Brandeis explains, new information will dictate how zoos, farms, and animal sanctuaries operate moving forward.
On this 93-acre sanctuary, they're my passion. Bobby Brinks devoted her life to the animals who now call it home. They're kind of like my children. Each animal brought to the Lions, Tigers, and Bears sanctuary carries scars from the past.
We help get them out of situations where they don't belong or they shouldn't be.
Because she doesn't rescue primates, Brink wasn't overly concerned with COVID-19. With similar genetics to humans, they were thought to be most at risk.
A tiger at the Bronx Zoo in New York City.
That was until this news stunned the world.
When we first got the results, that was the concern, was were we going to have a lot of cases.
Veterinary pathologist Karen Terrio studies diseases in animals. She got a call from the Bronx Zoo when their tiger began showing symptoms.
But the good news is that the numbers of cases of animals that have tested positive have been really, really low.
Yet scientists still want to know how the virus affects different animals.
What sorts of species could be infected? Where could the virus sit? Could the virus infect a tiger and then mutate in a way that makes it more susceptible to humans or less susceptible to humans?
In the lab, animals like cats and ferrets were susceptible to COVID-19, while others like pigs, ducks, and chickens appeared not to be. In the real world, only a handful of dogs and cats have tested positive, and their cases were mild.
In all of these situations, it's the animal has been exposed to a person that had the virus.
And there's still no evidence animals can give the virus to humans.
We're not going to be real quick to reopen, and when we do reopen, it'll probably be small groups.
Zoos, on the other hand, typically deal with thousands of visitors.
Might there be certain parts of the zoo that open up and other parts maybe not so much yet, until we have a better understanding of how susceptible species are.
Just like everyone else, this is a learning game, so we're just waiting for more research.
In the meantime, Brink's doubling down on sanitary precautions, focused on protecting the animals she's dedicated her life to. In San Diego, I'm Amanda Brandeis reporting.
Well, one group is making sure thousands get the nutrition they need. The mission to serve people meals that are made specifically for their needs. Welcome back. Each day we end the rundown with stories that remind us of the good going on around us. God's Love We Deliver gives out more than 10,000 meals a day to homebound New Yorkers. The group says half of meal recipients live with 4 or more medical conditions. Demand is up 25% since the pandemic started, and the group has had to adapt. From masked kitchen volunteers to socially distant deliveries, it's fulfilling for volunteers and those who get the meals they depend on.
Food as medicine has, but also the personal contact.
God's Love We Deliver is just fabulous. I don't know what I'd do without it.
Each meal is made specifically with the person's medical and nutritional needs in mind. The group relies on private donations. Another great story. A family from Buffalo has several reasons to be thankful today. 5 people in the Pierce family were diagnosed with COVID-19. 3 of them had to be hospitalized. After receiving treatment, all 3 ended up being released. The family ended up spending 8 weeks at the hospital as they all battled coronavirus. Well, that's all the time we have today for Coronavirus, The Rundown. We'll see you next time. I'm Usher Qureshi. Thanks for joining us.